Hello, good afternoon, everyone. It is yours truly, your host, Dr. Barry, board-certified internist, podcaster, best-selling author, national speaker, bringing you another edition of the Lunch and Learn. We're on episode 47. Great times, happy times, exciting times. Today we're going to be talking about a very funny, not too funny topic, interesting topic, we should say. We're going to be talking about STDs. We're going to be talking about Mr. Usher, Raymond, and kind of how all of that kind of like combines. Unfortunately, if you have been, living under a rock, Mr. Usher Raymond was actually getting sued for exposure, very keyword exposure, of herpes to another individual. And I think actually last time I checked, it's like 3 individuals. So craziness. We're talking about STDs today. We're talking about, and I'm not touching on all of them because there's a lot of them. We're going to be talking about 3 main ones. We're going to be talking about syphilis. We're going to be talking about gonorrhea, and then we're going to end it with herpes, right? And if you are, already subscribed, you probably already know. If you're not subscribed, get subscribed on the podcast, because I actually have already put out the podcast for this episode. So if you don't got time to sit and watch this video, you can head over to Apple Podcasts right now and download the episode and, pretty much hear exactly what I'm going to be telling you on the live video front. And at least with the video, you do have some opportunity. If you got some questions to ask during it, you can ask questions. But if not, you got the audio version ready to go. It's already up on Apple Podcasts. It's up on Google Play. Some people have Pocket Cast. It's on there as well. Some people have SoundCloud. It's on there. It's everywhere. So pretty much wherever you can get your podcast listening pleasure, I'm already there. So let's start out. I've already kind of shared. I've already done like the nitty-gritty work. We're going to start out talking about syphilis and why syphilis is important. I think first of all we should kind of start out why, I personally want to talk about STDs in general, right? And why that's important. Again, I have a public health, a master's in public health from Nova Southeastern. Shout out to Nova Southeastern. And a lot of times the medicine aspect will always intertwine into public health. I think it does a lot more than people realize, but it does. So today when we're talking about all the STDs, we're going to see about how the public health aspect of it gets intertwined in that regards, right? So let's talk about pretty much the motivation, right? Over the past about 3 to 6 months, I've been reading articles on various STDs, but in particular, the 2 that we're going to talk about first when we talk about syphilis and gonorrhea. And when we talk about syphilis, we're going to be talking about how the incidence is rising. When we talk about gonorrhea, we're also going to be talking about why the incidence is rising, but for 2 different reasons, right? So very important to kind of get that inclination. And we'll talk about some treatments, some diagnosis as well, just kind of moving forward. But most importantly, so when we talk about syphilis, when we say syphilis, syphilis, obviously the STD, it is usually affected by, it's 3 different stages. There's actually 4 different stages of syphilis, right? You have primary, you have secondary, you have latent, and we'll talk about latent, why latent is really important. It would have the tertiary, right? Tertiary is something that in the hospital setting I will sometimes run into, because that means a person has had a syphilis infection for so long that now it's starting to cause problems, right? So now it's starting to cause problems much more vast than what we know when we talk about syphilis, right? So when we talk about the primary stage of syphilis, there are certain sites that syphilis will kind of present. And when it actually presents almost like a round, almost like a little circular lesion. And it can present in the genitals, the anus, the mouth. Those are probably your 3 biggest areas that syphilis is going to present. It's like this firm, painless, and it's important when I talk about painless ulcer, because when I talk about herpes, you're going to see herpes is actually a painful. And in the medical standpoint, that's one of our key characteristics of telling whether am I dealing with an ulcer from herpes or really whether I'm dealing an ulcer from syphilis, right? So very important to kind of be able to differentiate the 2, especially from a medical standpoint, but even obviously a clinical standpoint for you guys. So this stage, right, again, we talked about the 4 stages. This stage lasts about 3 to 6 weeks, right? So for a lot of people, and again, I've taken care of a lot of patients. For a lot of my patients, this stage goes by so quickly, they don't even realize something is wrong. Because for a lot of people, something will happen, they'll get like a little wound there, a little sore. What is that? What is that? And by the time they get to the point where they say, you know what, I need to take action and do something about it, it's already gone, right? So what happens, right? If your body takes care of it, you kind of think it's gone away. And that's usually the worst way of thinking, especially when we talk about syphilis, right? Letting your body, quote unquote, fight off syphilis does not happen, right? Because we know those round lesions only last for about 6 weeks at the most, and then they're gone, right? For some people, it's a lot shorter. So by the time they even think like, all right, I need to go to the doctor to get this looked at, it's already gone. So what do? They say, I don't need to go to the doctor anymore, it already went away. So that's the primary stage, right? And again, the treatment course is pretty much the same throughout until it gets to that tertiary stage and it starts affecting some more problems, right? So the secondary course is a rash, swollen like lymph nodes, or which are like these like lymph nodes that kind of, usually most people get them around the neck whenever they get like a head cold, and because of that drainage, your lymph node catches the infection. So that's usually some of the most common places, sometimes in the arms as well in that regards. Latent stage, this is our third stage of syphilis. The problem with the latent stage is that nothing happens. Absolutely nothing, right? You don't get no sore, you get no cough, you get no rash. Not a single thing actually occurs during the latent stage. And why is that bad? Because that can last for months up to years. So you're going to have syphilis for years and not even know it, right? Because that 3 to 6 weeks time frame in the primary stage that passed, that secondary stage when it was just a little rash, you put some hydrocortisone, you thought it was gone, and then boom, you're in the latent stage. And the problem with that latent stage is the whole time the cells is dividing and cooking and causing all kinds of problems like in your system, right? And you don't even know it, right? It's causing all these problems in your systems, and it's not until you get either older or time passes, and a lot of times we'll tend to see it, especially in the hospital setting, we'll tend to see this older, we'll see it, and we'll talk about the tertiary stage, right? Because the tertiary affects the brain, tertiary affects the eyes, heart, all these other different organs, right? That syphilis is now like invading. Before it was topical, before it was just affecting the skin, but then because you've allowed it to linger on so much, you didn't get treatment when you could have got treatment, or it kind of came and went before you wanted to get treatment. Now we're dealing with it in the brain, now we're dealing with it in the eyes. So of course, if it's in the brain, what are we thinking about, right? We're thinking about issues with headaches, dizziness, we're thinking about issues of forgetfulness. A very common way a patient will come into the hospitals if they're confused. And one of the most common, any patient who walks into this hospital now, especially if they're elderly, because remember we talked about latent lasting for years. If they're elderly and that they're acting confused, one of the first tests we always order is the syphilis, right? We always want to make sure, all right, let me make sure it's not, I'm just dealing with like a late stage syphilis and that's why they're confused. And I've had a couple of patients over my time where that was it, right? Like it wasn't a stroke, it wasn't a seizure. We're checking for syphilis. Ooh, boom, they got syphilis. We treat for the syphilis. They start getting better, right? So very important to be able to kind of pinpoint, those issues, because again, that's the late stage, right? That's a person who's probably had syphilis for years on years and didn't know it because it went away so quickly, and then they end up in a hospital for all of these other, crazier and ridiculous problems, right? So why is it important, right? Because the article I read, right, it talked about the rise of syphilis, right? It talked about how the rates of syphilis at one point was decreasing to the point where we thought we was going to get syphilis out of here, right? We thought syphilis was going to be one of those diseases that, almost like, the smallpox and the measles, like almost like one of those, right? We know those, ones where, everyone's not getting their shots no more, so now it's starting to creep up. We thought it was going to be that, right? We thought we was wiping it out of there. And of course, fortunately, what's happening, it's not anymore. And what's happening is that it's in the groups that we're finding it in particular are gay and bisexual men, and then pregnant women. So pregnant women, gay, bisexual men, those two groups are having the fastest rise in syphilis, right? So for the past 20 years, we have, well, not the past 20 years, we have, like at this time, 2017, we have the highest rate of syphilis infections from an increasing rate than we've had in 20 years, right? Because so many more people are being diagnosed and having to be treated for syphilis that we didn't have to worry about in the past, right? So what's the problem, right? What's the problem with, especially pregnant women, right? Like what do you think a problem with a pregnant woman getting an STD, right? if you had to think about it, of course, it's the kids, right? So now, unborn children are being devastated with diseases like syphilis that pass through, the placenta and, cause damage even before they're here to stay, right? So that's something that we be very mindful of. And when I talk about the pregnant women, I can tell you right now, most pregnant women, if they're if they're following someone like an OB, midwife, somebody, they're screening for all of those STDs, right? So it's not like a surprise. It's not going to ever be a surprise that you have an STD if you're following an OB, right? Because they're screening for everything under the sun, right before you get there. So that's not really something you're going to have to worry about and be concerned about in that regards. But it's the ones who aren't following up with care, don't have anyone to follow up with, and then they end up getting the syphilis, and then the baby ends up having problems as well too, right? I guess fortunately have not had the chance of taking care of someone who's had syphilis, especially during pregnancy. I just haven't had a chance, but it's always something that we're very mindful of, right? And there's a lot of components that kind of deal with why syphilis is rising too, right? We talked about the two groups, right? So gay, bisexual men and pregnant women are the two fastest groups for being diagnosed with syphilis. But the reason being, right, and again, this is where the public health person comes in, right? Because of the infrastructure of where public health is in regards to like these health clinics that used to be everywhere, and we're seeing less and less of them being funded, which means less and less people have a way to go, especially the uninsured patients. And for the treatment course, right, is penicillin, right? But it's not like the penicillin pill you take, right? It's actually an injectable penicillin, right? That a lot of your health departments usually have. They usually have on hand. Boom, you get the one shot. I think it's like sometimes they do a series of like 2 or 3. But you get the shot, and then the syphilis is gone. They don't have to worry about syphilis no more. But what's happening is because you're having less funding to the public health centers, you're having less centers in general, and then even if you do have a center, because of the funding aspect, you don't have that many people working there, so supply of, the amount of people who need to come there is high, but the amount of people who can take care of them is low, right? So you got all of these different factors here that are playing a role in this rise in syphilis, right? So I think it's very important to understand that syphilis is something that we need to be very mindful of. Like I tell you, when I do my STD screenings in my outpatient practice, I always order for syphilis, right? Like HIV, chlamydia, gonorrhea, syphilis. And the question I always get, well, doc, what are you checking for syphilis for? I don't got no sores, right? And I let them know, well, you could have had the sores for a couple of weeks and it kind of went away. Now you don't think about them. And again, I've had a few patients where we're like, oh, person got syphilis, and let me tell you what's happened. Especially how our government looks at like syphilis and HIV and a couple other diseases, right? Before I get the results that like let's say I do a blood test on you, right? Before I get the results that a blood test is positive for syphilis, the laboratory already sends a copy to CDC, right? It's usually like a local CDC, but usually a copy to the CDC, right? Before I get the results. Before I even look at the results, 9 times out of 10, the CDC is already contacting my patient saying, hey, you have a positive result or this, where can we find you so we can treat you, right? Because we don't let that linger. We don't let people just walk around with syphilis, especially when we know, right? Best example, right? I had a patient who was diagnosed with syphilis and didn't really understand. It was a language barrier issue, but didn't really understand. So, we called them and said, hey, you need to come in. They missed their appointment. Boom. Missed her appointment. Let me tell you what happened. CDC, someone from the CDC came to my office like that next week. Like, hey, what's going on? We saw that this person had syphilis. They had an appointment, but they didn't come because we didn't see any note from it. So I said, well, yeah, they didn't show up. So what did they do? They called that person. The person wouldn't pick up the phone because they didn't know who it was. They went to that person's job. They said, hey, you know what? You've been avoiding us, and we're not sure why you've been avoiding us. It was a language barrier. It wasn't malicious, but yeah, you need to get treated. And they pretty much said, all right, you're gonna come here on this day, or we're gonna come back to your job to find you, right? So that's how serious our government takes syphilis, right? So we understand syphilis is definitely not something that we brush off, but the problem is it's being brushed off for different reasons. And I think we just have to focus on the communities who are being affected the most. Again, gay, bisexual men, again, pregnant women. Not to say everyone else does get it, but those are the two groups are getting it the worst and are becoming more devastated from it. and focusing on our health practitioners, just making sure that us as physicians is actually asking and making sure we're getting good histories, making sure we're actually ordering the test, right? Like again, we're not even ordering the test. Not sure why. Like again, sometimes I'm surprised at some of the stuff that our physicians are not doing, right? Especially in this day and age, especially in the community setting, right? Because we're not doing a good job for our patients, right? So next, we're going to be talking about gonorrhea, right? So gonorrhea is an important one, right? Because I read the article was something about this STD superbug. I'm like, oh Lord. So let me see what they're talking about, right? And they're talking about how gonorrhea is increasingly become resistant to azithromycin. So I'm like, I already know exactly who to blame, right? So if you're thinking, you're listening later and you're saying like, what is azithromycin, right? If you've ever went to an urgent care center, because they like to give them like candy. If you ever went to an emergency room, they like to give them like candy. Or you like going to your doctor's office and every time you say you got a cold, he give you an antibiotic. If you ever been prescribed a Z-Pack, that is azithromycin, right? So what's been happening in gonorrhea, in the history of gonorrhea, and again, I'm going to talk a little bit about it. We've been fighting gonorrhea, and we've really been losing that battle. Like, we just honestly and truly have been losing the battle against gonorrhea for almost like 30, 40 years now, right? Since the 70s and 80s, right? We've been trying to deal with it, and it's really been winning, unfortunately, right? So let's give some facts, some numbers for gonorrhea, right? So numbers on gonorrhea. 800,000 infected each year, right? New cases. Not like, people who have it. No. 800,000 new cases of gonorrhea every single year, right? So 800,000 people who need to be treated every single year with the same treatment regimens that we got, right? But fortunately, half of those are even reported, right? So half of the people who have gonorrhea are not reported, and I'm going to tell you why in a minute, right? In that regards, right? Untreated women can result in infertility. Untreated women can result in increased risk of HIV. Men become men as well. So this is important too, because I don't think the men be trying to avoid it. Like they can get some harm too. If you're a man and you got gonorrhea and you don't get it treated, you could become infertile as well too, right? So that's very important. What's going on, Sean? Appreciate you for joining. We're talking about STDs and Mr. Usher Raymond today, right? And I talked about how more and more people are becoming more and more gonorrhea infections are becoming resistant to our treatment course, right? This is a battle we've been losing for the past about 40 years, right? Since like the 70s and 80s, we've been dealing with gonorrhea, and we've just been losing, right? And when I say we've been losing, right? Well, in the 80s, we had a couple treatment rates. Let's say we had like 6 different antibiotics we could use to treat it. And slowly but surely, right, it's becoming resistant to this bug. It's becoming resistant to this antibiotic, to the point where, like, at this time frame, right now as we speak, in 2017, we got 2 antibiotics that can treat it. 2 antibiotics, right? One, you got to get an injection, right? One, you got to get an injection, an IM injection. The other is a pill form, and the other was that Z-Pack, right? But now I'm reading this article that says more and more people are having gonorrhea that's resistant to the azithromycin, right? So it's very scary time, especially from a public health perspective, because we're getting less and less new antibiotics coming out. Because it's really not a lot of money, especially if the government's not doing the research on antibiotics. There's really not a lot of money behind it, so we're getting less and less treatment antibiotics that can be used, especially on an outpatient basis. I definitely foresee in about 5 to 10 years, even sooner, if you have a gonorrhea infection, I'm gonna have to put you in the hospital for IV antibiotics. Like, that's the direction we're going with, right? Because our oral antibiotics just isn't working, right? So that's the scary thing, right? Imagine, again, you got a gonorrhea infection, you got to be in the hospital for like 3 to 5 days. But that's where we're going, right? Because this gonorrhea is not playing with us at all, right? So what is gonorrhea? What does it affect? Gonorrhea affects genitals, rectum, the throat. Usually affects younger people aged between 50 to 24. What groups, like from a symptom standpoint, what happens? Like if you're men, Men tend to get like this burning urination, painful urination, some discharge. Well, usually discharge is a big thing. What usually brings men to the office. I've talked about it in previous Lunch and Learns that two things get a man to come to the office, right? One, if they need sexual pleasure with like Viagra and all this other stuff. The other, right, if they need to check their STDs, right? Like those are two things that I'm guaranteed for sure that can bring a man to the doctor's office. And we just hope that the other problems, diabetes and hypertension, all this stuff, they should be coming to the doctors for it gets kind of taken care of from that standpoint, right? So very important, right? But what's more deadly and what's concerning, right, is that in women, a lot of times they get no symptoms. So a woman can have full-blown gonorrhea just like that man. That man has penile pain, discharge, but the woman will have no symptoms whatsoever, right? And that's what's the problem, right? Because even though they're not having any symptoms, right? Even though there's no issues in terms of like pain, and they may have it, and I'm going to talk about what they may have. They may have symptoms, but a lot of times those symptoms seem a little similar to when they have a urine infection. So what do? They just get a quick antibiotic for the urine infection and then keep it moving, right? Because they think that's all it is, right? But all the while, the gonorrhea is causing a havoc, causing, a ruckus in their system, right? And that's why a lot of them end up being infertile, because the infection is so bad and it damages their ovaries, the pelvis, and all this structure so much. Again, I'm not an OB, right? So don't quote me on like all of the structures, but it causes such a detrimental effect on their reproductive system that they become infertile, and all the while they got no symptoms to show for it, right? So that's why it's extremely important, especially for men, to get tested, get checked, but also the women as well. To women usually, because women usually go to do their wellness exam. Well, they not like us, right? We for a wellness exam, like I said, I got my homeboys who come to see me on wellness wise. Well, they used to see me. I don't, because I do inpatient now, so they don't. But they'll see me, I think, just off the strength. But I think if it was left to their own accord, they probably wouldn't even do that. In that regards, where women, because of the pap smears and everything, they tend to go a little bit more frequently than us, and then they like going to the doctors, right? It's not a taboo for them to go to the doctor, right? So they get their health care and checked from that aspect there. So that's the problem with gonorrhea, right? And again, when I talked about the treatment, of course, again, we got two medications right now that do it. One that you need an injection for, one you take a pill for, right? But slowly and surely, like I said, I'm thinking in 5 to 10 years, right? Especially, and I'm thinking this is, me, the public health in mind, thinking that if, we don't do something about this, like right now, yeah, I really am going to have to admit people to the hospital for this infection, right? Like that's what's going to happen, right? Your doctor's going to do an outpatient screening of gonorrhea, find out you got gonorrhea, and then put you in a hospital, right? Because that's where we're going in that regards right there, right? So again, gonorrhea is another one. And like I said, all these STDs cause problems, right? But I just wanted to focus on like these three for sure. But get tested, right? At the end of the day, get tested, get prevention, wear a condom if you're going to wear a condom. If you're not going to wear a condom, make sure the person you're not wearing a condom with is, clean as well too, right? Like you cannot be, especially in 2017, we can't allow ignorance to be the reason why we're still getting like these diseases, right? Oh, I didn't know. No, like that's not an excuse no more. Like HIV is real. Like a lot of people are scared of like the HIV and stuff like that, which I would be definitely scared of too. But just remember, these gonorrheas, these chlamydias, and all these other things cause just as much problems. So much important to really like focus and be about prevention, right? So we're gonna end off with herpes, right? And why am I talking about herpes? One, because our friend Mr. Usher Raymond, R&B singer, if you don't know him, is like being sued by I think 10 people. I don't know. He's being sued by some people for exposing, and I stress the word exposing, not infecting, exposing, because we can't really prove, to the T that he was the one who infected. We just have to kind of put all the points together and just make the assumption that he did it. For exposing women, and I think there's like a men too. I don't know, for with herpes, right? And the reason why they know this is because he had recently, I guess, settled a case, and I read the court documents. He recently settled a case with a woman who said that he was the one who gave her herpes, and the problem is that he knew that he had been diagnosed but never told her, right? And that's a big thing, right? Like, if you know you're diagnosed with herpes, you actually have I'm not sure about legal. Like, again, we're still, and I'm going to talk about why, legal option is going to be stretched, right? But like, you do have an obligation to tell your partner, like, hey, I got herpes, just in case. So, and we'll talk about why it's important, because even if you don't see no lesions or nothing, it's still important to know, because, obviously you could still spread, especially if that was the case, right? But I'm on social media a lot. So I'm on social media a lot, and I'm on Twitter, I'm on Facebook, and I keep seeing people post, right, about how Usher infected this lady, and the terminology is just like, he did not infect this lady, right? Like, he likely exposed her to it. Again, we can't 100% say he did. He likely did, though. I mean, just from a timing and just based on what the court documents were saying. But we don't know. So now you have all of these people here who are like ready to like sue. And say, hey, no, I had sex with Usher too. Like, and he didn't tell me, so now I can sue, right? And that's gonna be, and we're gonna talk about why that's such a huge. It's going to be a huge liability, right? It's a huge liability, right? Especially when we talk about like herpes and all like the components of herpes, right? So let's kind of go in on, what herpes is, right? So from an infection standpoint, I talked about how you can have the exposure of herpes, and because of the time frame likely caused from an infection, but the reason why I say it's very difficult to say he infected her, because we do not do any DNA testing on every single herpes virus to see if you have this specific one, right? We don't do that, right? Because it would cost way too much money, and it actually makes absolutely no sense to do so. It doesn't make no sense whatsoever. What we usually do when we're testing for herpes is we're actually testing like the antibodies to see if you have antibodies against the virus. And we can kind of test to see whether you have old antibodies or new antibodies. So we can do that, and we can test the different types, right? So there's two types of herpes, right? Type 1, type 2. We're going to talk about both of those types kind of moving forward, right? In fact, we'll just talk about them now, right? So usually takes, especially regardless of which one you take, usually takes about 2 to 4 weeks, like if you get exposed to it, for something to happen, right? So 2 to 4 weeks before, if you get exposed to it, that something actually arises, right? But that's definitely not the case in that regards. So when we have the herpes, right, we have type 1, we have type 2, and hold on for a second. I think somebody's having trouble. I think they're gone. Someone's knocking on my door, but I think they left already. So we have herpes type 1, type 2, and we're going to talk about the numbers of herpes, right? So from a number standpoint, herpes is the most common cause of painful, remember painful, because when we talked about syphilis earlier, it was painless, painful genital ulcers in the United States, right? The most common cause. Type 1 is usually contacted during childhood, whereas type 2 usually contacted during puberty. And the reason why that puberty is important, because it's usually contacted during sexual activity. And when you have sexual activity, you have that risk or increased risk of having the herpes infection, especially for the type 2 aspect of it, right? So these are some numbers that I really want you guys to kind of think about, right? So especially when we talk about being able to sue somebody for exposure to herpes, right? By the age of 30, 50% of people, and they did this study, according to CCC, did this study based on, because they used to think herpes was like a poor person's disease, so they're like, oh no, I bet the rich people don't have herpes, it's just a poor person's disease, right? Of course they were wrong, right? So by the age of 30, 50% of people with herpes 50% of people in a higher socioeconomic status, again, people who make a little bit more money, a lot more money, I should say, are positive for herpes antivirus, right? Are positive for it, right? Whereas in the lower socioeconomic status, about that number jumps up to about 80%. So it does tell us that yes, people in lower socioeconomic status are more likely to have it, because clearly they do. But I think a more telling stat is this next one, right? By your 5th decade, right? So by the time you're 50, 90% of you will be positive for either part 1 or a part 2, right? So let's think about this, right? We're going around wanting to sue someone, right, because they exposed them to the herpes virus, right? And 90% of you guys will have antibody positive for it by the time you hit 50, right? So that's where that's where it's becoming very concerning, right? And I know in my office a lot, I get patients who always want to like check for herpes, right? Like, oh, can you check to see if I have herpes? And I tell them very quickly, I say, all right, we can check for it, right? But there's a high likely that you have it, right? Because there just is, right? Because it is that common. And if you got it, right, I want you to let you know now, I'm not saying that you're going to get an outbreak tomorrow. I'm not saying you're going to get an outbreak next week. And nor can I say you're never going to get an outbreak. I'm just saying now that you know you have it, right? Like if that's an answer you want and you can kind of deal with that answer, go right ahead. But if you don't want to know the answer, like it's probably best not to do it, right? And the CDC actually tells us not to check for it routinely, right? The only time I check for an antibody is if a person has those lesions or ulcers, and I'm concerned, like, oh, you know what? I think this is herpes, and I want to make sure, like, I'm ruling out, like, okay, I think this is herpes, and I want to kind of confirm it. But we're not just randomly checking for herpes because, again, like I said, by the time you're 30. Depending on which socioeconomic bracket you sit in, you're 50% likely to have it, right? So that's why we don't even check for it at all. Worldwide, these are some crazy numbers. 23 million people worldwide will have this antibody, right? So this is a very common thing, right? It's not like this rare occurrence, like, oh my God, or sure has it, or just so, like, no. A lot of people are positive for these antibodies, right? And when you talk about genital herpes, right, the format picture used to be that type 1 was more related to oral herpes or herpes labialis, and type 2 was genital. But we now know that type 1 herpes causes more cases of genital herpes if you're in that younger population or in that population where gay men having sex, gay or bisexual men, right? So we know that if you have genital ulcers, right, due to herpes, and you're in that young group population, it's more likely going to be due to type 1 than type 2, right? So again, that's something I try to tell my patients as well too, right? Like, I know you probably read that, type 1 is the mouth and type 2 is the genital, and you could throw that out the window, right? So just knowing exactly which type you have is not going to let you know whether you're going to have genital versus oral, right? Because we know the incidence is high regardless of which one you choose, right? So it's just important to understand that, these numbers are, increasingly, common. And in the case of Mr. Usher, because of how, I guess, promptly, just when I read the court papers, apparently, like, how promptly she presented with her herpes outbreak, and then I guess she had a doctor who she had been following who must have tested it before and said, well, you didn't have it when I tested it over here. Again, I'm not sure why he would have tested it over there. Maybe she was pregnant or something. But whenever she got tested, she was negative, so that's why they were able to say, like, yeah, you probably were the one to cause it, and especially because he knows he has it, right? And again, we'll talk about, what does that mean, right? But again, like, I think the popular question always goes, well, if you have it in the mouth, they talk about type 1, they talk about the genital, but herpes also affects the skin. Herpes also affects, like, the general trunk of the body, right? If you think about wrestlers, they get one, it's called herpes gladiatorium. It was like a gladiator. Like, so they'll get it around the arms, the trunk, and the back, just because it's a skin-to-skin contacting, right? Herpes labialis, that's the one that affects, like, those are your oral, quote-unquote, canker sores. Herpetic whitlow, that's where some people can actually get, herpes infection, on the hands and fingers. And this happens for people who, let's say if you get bitten, let's say you're for some reason you're a dentist and you don't wear gloves, don't know what, have no clue why you'd be sticking your hand in someone's mouth and not wearing gloves, but let's say some crazy reason you don't wear gloves, right? You can get herpes that way too, right? But usually, like, think about it like you're fighting, somebody bites you, and that's the cause, right? And like I said, because it's so prevalent, right? Like, you've probably been around people who are like, don't kiss my baby, right? Like,
a lot of people, and I think my wife's watching. Like, she's big on that too, right? Nobody could kiss the baby, right? Grandparents, aunts, nobody don't kiss the baby in the face, because unfortunately, that's a very common route of not common, but that is a route of transfer of herpes, especially for the neonates, right? You know, someone has, you know, herpes on the mouth, kiss the baby, boom, now the baby's got herpes, right? So my wife was big on, like, I don't want nobody kissing my baby in the mouth, but she was big on that. I was big on it. If she was big on it, I was big on it too. So whatever. So we, you know, no one. I don't think I could kiss the baby in the mouth for a while as well, because you know she's crazy like that. So let's talk about. So we talked about just the general symptoms. Herpes. You get the lesions, very common. Make sure understand it's painful lesions. For women, it affects both external and internal reproductive genitalia. You get painful urination. For men, they get painful lesions as well. Men also get a lot of discharge, especially when the herpes begins to start crawling up the urethra, or quote unquote pee hole. When it starts crawling up the urethra, a lot of pain, a lot of discomfort, right? So very important. And I think the key thing is that there is no cure for herpes, right? None at all. That's why Usher, who knew in like 2009 they had herpes, right? It does not go away. When we give you a medication for herpes, cold sores, an outbreak, I'm giving to you to try to like suppress the replication systems and then make it go away, so you at least don't see it, but you still have that virus, right? And you will forever always have that virus in that regards, right? So that's why that's you know, I think that's probably the biggest health concern, is that because you'll always have that virus, you'll always have the risk of being able to pass it on. That's why you have to be very forthcoming to your sexual partners, especially the ones who've been diagnosed with herpes, right? Understanding that, yeah, I may not see a sore right now, but like that doesn't mean that I can't give off the virus and shed the virus and give it to my sexual partner in that regards. And I think, and that's why Usher had to write that check. I think he wrote like $1 million check to that lady. He had to write that check, right? Because, you know, he was diagnosed with it. He never told her. That was the big thing, right? So now all really, you know, Usher has to do from now on, well, I don't think he has a choice. He has to tell people, hey, I got herpes. I'm just letting you know right now. Even if you don't see nothing, I got herpes. There is a chance you can get it. Just letting you know, right? And, you know, you got to kind of go from there, right? So that's it, right? So that's, you know, that's herpes. That's kind of herpes in a nutshell. So we talked about, what did we talk about today? We talked about 3. We talked about, we talked about syphilis. We talked about gonorrhea, and we talked about herpes, right? So we talked about all 3 of those, you know, STDs, very common ones. Again, we didn't talk about, like, you know, the HIV, the big one, and all. We didn't talk about that. You know, we talked about treatment courses, and we talked about, you know, how to prevent it, of course, you know, and being more knowledgeable, protect your sex, use condoms if you want to. If you don't want to, get everybody tested. Like I said, it's 2017. We can't be continuing acting like we shouldn't be tested when we're supposed to, right? But, you know, that's where I'm at today. Again, like I said, I do have this already on the podcast, so go ahead and check the podcast out. And podcast, Apple Podcasts, Google, Stitcher, SoundCloud. It's already there for you, especially if you don't have time to catch this video. You guys have a great one. This is episode 47. I'll put the blog post up later on today, and you know, you could watch the video at a later base. And I'm gonna see y'all later. Bye.